It's one of the most frightening symptoms you can have, isn't it? That racing heart, that fluttery feeling in your chest, that sense that something is just not right. It sets off every alarm bell in your body. And if you're feeling that, you're looking for answers, and you're looking for them now. That's exactly what we're going to cover today, the direct link between low iron and those scary heart palpitations.
I'm willing to bet this sounds really familiar. You're just sitting on the couch, maybe you just walked up a flight of stairs, and all of a sudden, your heart is just pounding out of your chest. So you pull out your phone and you start typing. Well, you've come to the right place. The answer to your question is a huge, resounding yes. And stick with me because understanding why it's happening is going to completely change how you feel about it. It's going to take the fear away.
Okay, let's dive right in. To really get why your heart is suddenly working overtime, we've got to talk about iron's #1 job in your body. And it all comes down to one thing: oxygen.
So think of it like this, a simple chain of events. Iron is the star player in hemoglobin, which is the little molecule inside your red blood cells that grabs onto oxygen and carries it around your body. So, low iron means less oxygen on every single blood cell. Now, your body's incredibly smart. It senses this and comes up with a plan. To get the same amount of oxygen to your brain and muscles, it has to move the blood around faster. And how does it do that? Your heart pumps faster. So the palpitations, they're not the problem. They're your body's solution to a delivery problem.
This whole process actually has a medical name: compensatory tachycardia. I know it sounds a little intimidating, but all it means is your heart is doing exactly what it's supposed to when it's faced with a supply shortage. That racing feeling isn't a sign that your heart is failing, it's a sign that your heart is working extra hard to take care of you. It's not the problem, it's the solution.
Right? But then you ask, okay, why does it get so much worse when I do something as simple as carrying in the groceries or walking up the stairs? This is such a key question, and it's a huge piece of this puzzle.
See, when you're just sitting still, your heart's slightly faster pace might be just enough to keep everything running smoothly. But the second you ask your muscles to do some work, their demand for oxygen just skyrockets. So your heart, which is already working overtime, has to kick into an even higher gear to meet that demand. This right here. This is the classic, textbook sign of palpitations caused by iron deficiency.
Now, let's talk about what is, for so many of you, the most frustrating part of this whole journey. You have these very real, very scary symptoms. You go to the doctor and you get the call. Everything looks fine. Let's break down exactly why that happens. This chart is everything. It shows you that your symptoms don't wait for your blood work to look bad. Just look at stage 1. Your iron stores, that's your ferritin, are already in the tank. But your hemoglobin, the thing they usually test, is still in the normal range. And yet this is exactly when the fatigue, the brain fog, and yes, the palpitations on exertion all start. Your body is already struggling long before a standard test would ever catch it.
And this is the number I want you to burn into your brain: 30. Anything below 30 nanograms per milliliter for your ferritin level means your body's iron savings account is officially empty. You could have a ferritin of, say, 25, feel absolutely awful with palpitations every time you stand up, and your hemoglobin could still look totally perfect. This is the hidden gap where so many women's symptoms get dismissed.
So understanding this gap is step 1. Step 2 is using that knowledge to fight for yourself and get the real diagnosis. So how do you tell the difference, and what exactly should you be asking for?
Okay, this slide is really just for peace of mind because it helps you see the difference. On the left, we have the hallmarks of iron deficiency palpitations. They're usually fast and fluttery, but the rhythm is regular. They get triggered by exertion, and they usually come with friends, like fatigue and shortness of breath. Now on the right, you see the red flags. These mean you need to see a doctor right away. An irregular heartbeat, chest pain, fainting. This isn't for you to diagnose yourself, but it gives you really important context.
Let's just take a breath and pause on this one, because this is the most important message you're going to hear today. These palpitations are not dangerous. Your heart is an incredibly strong muscle, and it's just compensating. This is not causing permanent damage, and, best of all, it is 100% reversible once you fix the underlying iron problem.
So why does this feel like such a women's issue? Well, because it is. It's just simple physiology. Heavy periods month after month, the huge iron demands of building a baby during pregnancy, postpartum recovery, it all creates this massive, slow-motion iron deficit over years. Your body has just been giving it away without anyone keeping track of the balance.
And there's one more layer to this. A B12 deficiency can cause an identical set of symptoms, including the palpitations, for a very similar reason. And guess what?
These two deficiencies love to happen at the same time. They're like best friends you don't want. So it's always a good idea to check for both.
So with all that in mind, what do you need to ask for? To get the full story, you need more than just a basic blood test. The number one most important test is ferritin. This measures your stored iron. It is not usually part of a standard checkup, so you have to ask for it by name, along with these other tests that give a fuller picture, like a full B12 and folate panel.
And here it is. This is your script. You can literally say this word for word. Using specific language like this shows you've done your homework. You're clearly linking your main symptom, palpitations on exertion, to the exact test you need. This helps you have a much more productive conversation and get to the root cause way faster.
All right, so you've done the hard work. You've gotten the diagnosis. Now what? Well, the path to feeling better is actually pretty straightforward. And the best news is that these palpitations are often one of the very first symptoms to improve.
So here's a realistic look at what to expect. Usually, within the first 4 to 8 weeks of taking the right supplement, you should start to notice those palpitations calming down as your hemoglobin levels come up. But full resolution, feeling like your old self again, that tracks with rebuilding your ferritin stores, which can take about 3 to 6 months. And the goal isn't just to get in the normal range. The goal is to get to an optimal ferritin level, which is up around 100 to 125.
But here's the catch. Getting to that optimal number can be really tough. Why? Well, because most iron supplements out there are kind of terrible. This chart shows you the problem. With a lot of the common synthetic iron pills, your body only absorbs about 3 to 5%. The other 95+% just hangs out in your gut, causing all that awful constipation and nausea that makes so many people quit before they even start to feel better.
You just can't fix the problem if you can't stick with the solution. So what actually works? The key is to find a type of iron that your body recognizes, absorbs easily, and that doesn't make you feel sick.
This is why the kind of iron you take matters so much. For example, animal-sourced iron, like the kind from bovine spleen, has a naturally high absorption rate and it's so much gentler on your stomach. And specifically for palpitations, it's really smart to think about a formula that also has B12 and folate already in it, since we know how often those deficiencies show up together, causing the exact same symptoms.
So let's just bring this all home. That scary flutter in your chest, it has a name. It has an explanation that's rooted in science. It's your body's smart, protective way of dealing with a simple nutrient gap. You get what's happening now. You know it's not dangerous. And most importantly, you know that there is a clear, straightforward path to making it stop for good. So the question isn't, what's wrong with me anymore? The question is, am I ready to fix it?